Good morning, everyone. So I'll just take a step back and give you an update. So YD spoke about, Mr. Sapkota spoke about the global targets, where do we stand and what's happening with that. But I'll just take a step back and give you an overview of the region, what's happening in the entire region in terms of targets as well as other issues which are happening in the region. So as you all know, Southeast Asia comprises of 11 countries, and uh, all these countries are quite scattered across different, include from Timor to I think it's India and Nepal. And IPB came by this strategy almost more than 5 years, nearly 5 years back. During pandemic, after pandemic, they came with the strategy of three-pronged strategy, which is Peter spoke about: elevate, integrate, and activate. Basically, putting eye care as a developmental issue and also as in terms of educational issues. And YD spoke about all the documents which we had come up, and we were speaking about like these are all the resolutions which have been passed, and WHO came with multiple documents, and then probably I think there is a gap between the documents coming out and government using it and implementing it, and then probably that's the reason why we want to have a global summit, so that this all documents, all commitments translate to action. The first report on the global targets of effective coverage of cataract surgery and refractive error also came, which YD alluded upon, and we have the data on the baseline targets, but what next? How do we improve these targets? What do we do about it? I think that's something with $1 million question, because that's again how do we implement, how that each hospital, because it's individually has to be taken at the hospital level, and then only it becomes a country level data, and then only becomes we can report it. So right now we have baseline. Somehow we got the baseline because we were not using the 612 definition in the past, but we extrapolated, got a baseline. The data is being improved upon, and there are new data going to come this year about the cataract surgical coverage as well, as because as and when data comes in, they try to improve the data. So in IPB regional, we have these are some couple of priorities we did 5 years back when we were making the strategy. For the region, we made this following strategies like increase political will and elevate eye health as a cross-cutting development issue, ensuring inclusion in major national health policy. So one thing was basically eye care, include eye care as a development issue and should be part of all eye care policies. Strong leadership to advocate for eye health and integration into universal health coverage. So this was another strategy. We wanted to integrate eye care into universal health coverage, and part of all the nations should take eye care as part of universal health coverage, and then they should formulate the national plan to in the line of preventing, in reducing the avoidable blindness as well as improving the global targets on the cataract surgical coverage and refractive error coverage. And for the South Asia, when we were making the regional action plan, we included a diabetic retinopathy also, at the same time that we have to at least make sure 80% of diabetes are diagnosed, and 80% of those diagnosed are treated for sight-threatening retinopathy. So these were very broad targets where we want to use eye care. National health eye care should be part of national health policy, and government should integrate eye care into universal eye health, and also we should have a plan, and then subsequently there should be implementation of the plan. These were the 5 strategies, which is IPEC. I won't go into details of the IPEC strategies. This is basically a strategy document which can tell you that IPEC is a strategy which can be used to achieve universal health coverage in order to achieve our goal of achieving sustainable development goals. YD alluded upon the prevalence of blindness and visual impairment. These are the numbers keep changing, and we have data from almost all countries at different point in times, and now some data are old and we are trying to collect new data. And this was a strategy which was designed by the region for the regional action plan, which almost 2 years back, and we had this meeting which happened in Hyderabad 2 years back, where all the ministers of the region endorsed the plan and said that they would implement the plan. And then we went back, and now we want to look at what's happening with that. And when we looked at, this is the status of the plan. If you look at strategy plan, it's only there for Indonesia, and to some extent now Nepal has the plan, and some countries are in progress, like Sri Lanka is in progress. We've had a meeting 2 years back. So if you look at, you have good data on EXAT. effective coverage for cataract surgery. Refractive error data is coming in, but the last two columns where you have a strategy plan and national endorsement, I think that is something which is lacking, and so that's with the commitment which was given almost 2 years back, 3 years back, I think has to be translated to action, and that's the entire reason that we need to galvanize our efforts and ensure that all the countries come and take this plan, implement the plan. I had a discussion 2 days back with the NPC, National Program for Control of Blindness India program manager, and then what he said was, we are still developing the plan. So I told, it's almost 2 years, why it's taking so long to develop a plan? So he said, we will make sure that this year the plan will come. So probably we have to keep going behind them and talking to them that at least your plan should be there, and then it should be implemented. The plan should be implemented also. Country level advocacy is happening at different levels, and probably I won't go into details of the advocacy efforts, but at various levels we are trying to talk to different countries. We have the World Health Organization offices, WHO offices in these countries. We have IBB country representative in these offices. We have the national societies. They are trying to include the national societies as a member of IBB. We have All India Ophthalmic Society becoming member this year. We have Nepal Ophthalmic Society becoming member this year. So there are different societies because they are the one who are going to work and do action on the ground. The ophthalmologists are going to do action on the ground if you want to take care of cataract, if you want to take care of refractive error. We had optometrists, the vision technicians, the healthcare professionals, they have to take action. So probably we have to involve all of them so that the policies or the plan we discussed is translated to action. Widely alluded upon the 2030 Insight focus countries, and I think there is a lot of why this focus countries, because we felt that there are a lot of things which are working, a lot of conducive environment is there, a lot of synergies which are happening, a lot of we can use resources in these countries, and things are moving much faster and more comfortable and more conducive for us to navigate in the system and get things done. So at least show India was one of the thought which came up, but it was such a big country that each state becomes like a country. So we thought we'd start with small country and in the region, and then see how we cannot do everything in one go, but at least show how these countries have moved forward. So probably I think we took these two countries as an example, and I think we are making a pretty good progress, especially for Nepal. I will skip this. So I would like to all invite you for the 2030 Insight meeting, which is happening in Nepal this month, and probably all of you who have registered are welcome, but who are not registered would urge you to register for the meeting, because there are a lot of things going to happen. We are going to see a lot of action and probably a lot of things preparation for the global summit and what's going to happen next year. Thank you very much for your time and attention.
Thank you, Mr.